All right, welcome back to The Link, everybody. Jason Salas here, and we have a wonderful new sponsor who is joining the KUAM Link family. Thank you to our friends at FHP. This is something we're bringing to you on Tuesdays. This is the FHP Health Tips with KUAM, and we are setting off on this maiden voyage by welcoming a new friend to the Link family right now, Dr. Andrew Graves, a board-certified radiologist and department chair of FHP's Imaging Center over in Mooning, and his expertise and his insight. Because November, you may not know, is Lung Cancer Awareness Month, and we are really going to let you know why it is important that you get screened for lung cancer. So, Dr. Graves, welcome to the show, and very good to have you here, sir.
Thank you, Jason. Good morning.
Good morning to you, and thank you to the FHP team for partnering up with us on this. We're very, very happy to have you guys here. Seeing as how it is Lung Cancer Awareness Month, obviously outreach and educational campaigns are of critical importance and everything. So what exactly is lung cancer screening, and who qualifies for that, Doc?
Sure, that's a good question. First, any screening examination involves a laboratory test or an imaging study that is designed to detect a disease before there's any signs and symptoms. Before that, that the disease is there. So in the case of lung cancer screening, the goal is to detect lung cancer before your body tells you it's there. And we do this with a special CT scan of the chest. It's a low dose CT scan that uses specialized X-ray equipment along with sophisticated software that produces detailed imaging of the chest so that we can detect this cancer at that early stage when it is most treatable. So at FHP, we have a brand new CT scanner from General Electric, which is designed to do lung cancer screening, CT scans at a low dose with high detail to detect that cancer early. So a typical exam would involve you checking in at the radiology department at the FHP clinic, where you'd be greeted by the staff and oriented to the exam. After which they position you on the CT scanner table where they would place your arms up, and they would let you know that the table is going to move. And as it moves into the CT scanner, the imaging is acquired over the course of a couple seconds. And then afterwards, those images are sent for post-processing and then ultimately to me for interpretation. And the turnaround time for the reports is rapid. Mm-hmm. And those are sent electronically to the doctors so that they can act on those results immediately.
And I'm sorry, and I'm sitting upright this whole time. If I am being screened and everything, I'm sitting upright, or am I lying down?
You're lying down, so the table is flat. So you're lying down, and then we typically position the arms over the head, but it's not a prerequisite. Mm-hmm. So, and then the CT scanner looks kind of like a giant donut. It has a little aperture or a hole, mm-hmm. and that table moves through it. And it's relatively quick. It's not claustrophobic. The table moves through that area over the course of a couple seconds, and that's it. It's quick. It's painless. It doesn't require you to get an IV. Doesn't require you to have any special medications or receive a special dye or contrast like in some of the other imaging studies.
And I appreciate you saying it is painless, Doc, because I know a great many Guamanians, and including myself, I'm going to revert to 12-year-old Jason here. I was just about to say, does it hurt?
Yeah, absolutely. And there's a lot of needle phobia, and that's a real thing. And in this case, we don't need to have an IV in place.
Mm-hmm. Now, obviously, the whole purpose of this is to detect the presence of, I'm assuming, or the potential for lung cancer and everything. So can you emphasize the importance of doing this, for our island community? And, is it more important at certain ages for men or women, children, or the elderly? Or, how do we break down exactly who is the most, the demographic, I guess, that you're most concerned with?
Yeah, so first off, it's important to highlight that lung cancer is a particularly deadly disease, and that's why lung cancer screening is so important. It's the leading cause of cancer-related deaths in the United States and worldwide, and that includes Guam. And about 85% of lung cancer deaths occur in current or former smokers. And we have a significant smoking population on the island. In contrast, when lung cancer is detected early, you have the maximum ability to have it treated effectively. So you talked about who's eligible, what people should be thinking about getting a low-dose CT chest for lung cancer screening. So the U.S. Preventive Services Task Force recommends lung cancer screening in adults ages 50 to 80 years old who have at least a 20-pack year history of smoking and are either current smokers or have quit in the last 15 years.
Now, thank you for qualifying that, because I was going to say, like, I'm 47 right now, so like when I hit the big 50 and everything like that, I know I've got a complete workup that, my doctor is already looking forward to. Probably foremost, most men know at that age you should get, a colonoscopy and everything. So should I actually discuss now with my physician? I don't smoke and I never have, but should I actually talk to my doctor about making lung cancer screening like a part of that workup?
Well, the age criteria is one aspect of the eligibility or the inclusion criteria. There's also the amount of smoking that you've done over your lifetime. That's that 20-pack year history. And it's a way of quantifying your smoking where it assumes a pack per day. Mm-hmm. So a 20-pack year history is you smoked 1 pack per day for 20 years. But there's a number of different, like maybe it's a half pack per day for 40 years. Mm-hmm. So there's a number of different ways that you get to that cumulative burden of injury to your lungs from smoking, and that's quantified in that pack year history. So if you're over 50 and you have a 20 pack year history, then you meet the first 2 criteria for that. And then if you're actively smoking, you're included, or if you've currently quit smoking in the last 15 years, you're also included in the criteria.
Now, I guess further to that, Doc, because as I said, like I don't smoke, never have, and everything, but my father did for many, many years. So there was a lot of secondhand smoke to which I was exposed and everything. I'm sure my doctor would want to know that.
Yes.
Yeah.
So there's this rigid criteria for inclusion in lung cancer screening with low-dose CT chest, but in some situations, people with certain risk factors like secondhand smoke or maybe family histories, that getting a low-dose CT chest may be right for those patients also, but it wouldn't fall into the rigid criteria of what the lung cancer screening program involves. And that has to do with the way that these things come out of research projects, and the data supports the risk-benefit ratios in certain populations. Mm-hmm. And so they're looking at this particular subset, but your doctor can do that work of going through the history with you, secondhand smoke, family history, past medical history, and finding out if lung cancer screening is right for you.
Okay. And since it is a final question, Doc, since it is Lung Cancer Awareness Month, I know, FHP is, as I said, you guys are going to go really, really all out as far as, community outreach, marketing, making sure the word gets out, making people know how important this is to our island community. So for yourself as a radiologist, what tend to be the most common questions that tend to bubble up as far as, when it comes to lung cancer screening?
There's a couple different questions. The first one is often, who's at risk for lung cancer? The second one is, who should be getting examinations to look for cancer when they don't have any symptoms? And next is, what is the best test to detect cancer at its early stage? Mm-hmm. And the answer is that a low-dose CT chest is the only screening examination. It's the first screening examination to detect cancer at an early stage that can increase your survivability and reduce your chance of death from cancer, that mortality. Increasing your odds of beating cancer, that's what people are concerned about. How am I gonna detect this early and be able to beat it? And lung cancer screening is a tool that we have that we can do those things and maximize the benefit for our patients.
All right, and we do appreciate and we applaud, the work that you and your team over there are doing not just in November as Lung Cancer Awareness Month, but throughout the year and keeping us as healthy as you want. So once again, if you are between the ages of 50 to 80 and you have somewhat, and the extent to which you should consult with your physician, if you have some history with smoking and everything like that, you probably are a candidate to get lung cancer screening, and we, and certainly our friends at FHP, certainly hope you take advantage of that. So Dr. Andrew Graves with FHP, thank you so much for your time and for your insight. We really appreciate it.
Thank you, Jason.
All right, have a wonderful day.